everyone, greetings of the day. I'm Priyanjali from All About Skin Wellbeing. I'm sure all of you must be keeping good health. We all know taking good care of your skin is important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is very common on your skin or nails. Fungal infection or mycosis are diseases caused by a fungus, yeast, or mold. Mild fungal skin infections can look like a rash, can be itchy and annoying. So let's connect today with our skin expert, Dr. Sunil Kumar, live from Bangalore to enlighten us on the topic of fungal infection. Dr. Sunil Kumar is a MBBS, MD, dermatologist, cosmetologist, and hair transplant surgeon. Today, Dr. Sunil will be sharing with us his insights on fungal infection and its management. So let's connect with him. I believe Doctor is live already. Welcome, Doctor, to today's platform. The first question we all would want to know in
Hi.
your language is what is fungal infection and how can we tackle with the same?
Fungal infection is a very common skin disease. It affects mainly the outer surface of the skin. We call stratum corneum, which is just the outer layer of the skin. Most of the fungal infections affect the outer layer of the skin. Okay. In Kannada, we call it as hulkadi. It's called hulkadi in Kannada, where the fungus growth it will mainly in a circular manner. Round out circular lesions will be seen on the skin, and it will be associated with scaling and itching.
Right. Right. So, doctor, what can be the cause behind it? Does different parts, like fungal
Hmm.
infection in different parts, means different causes?
Correct, correct. Yes. Mainly it affects the frictional areas where the two skin rub each other, right? Mainly those areas we see fungal infections. Those fungal infections we call tinea cruris. It's mainly because of sweat, more moisture content in the skin, and because of friction and rubbing. All this will induce the fungal growth on the skin. Even that other areas
Right.
also can develop, especially on the back. People who sweat more, those people will develop a fungus called tinea versicolor. It's a different kind of fungus. Even in the scalp also we can get because of sweating, or even sometimes in the winter weather, more fungus growth will be seen. Even the other areas also like the oral cavity, esophagus, even to the genital organs, all these areas gets affected with fungus.
Right, right. So, doctor, this is the monsoon period. Like everywhere throughout India,
Hmm.
we are getting to see floods and heavy rainfall
Correct.
all over
Yes,
India.
yes.
So,
Yeah.
so can this season be one of the major reason for the occurrence of fungal infection?
Correct, correct. Yes, the moisture content in the skin will induce fungal growth usually. Yes, especially intertriginous areas where the rubbing happens and the more water content in the skin that
Right.
can affect. That's why we should keep our body dry. Even the clothes, whatever we wear, no, just be dry. Better not to wear wet clothes on the body.
Right, right. Doctor, you mentioned that fungal infection
Mm.
can occur at different parts in our body.
Yes.
So we have seen another kind of fungal infection which majorly appears on the corners of the nail. So although
Okay.
housewives who are rigorously working day
Correct.
out and day in at home, they are always in the contact of water, and we
Correct.
mostly see
Correct.
them suffering from this fungal infection.
Yes.
What is it called?
Correct.
The fungal infection which we
It's
generally see in
called
the nail area.
it's called tinea angua. It's called tinea
Right,
angua. Angua means nail.
right,
Tinea means fungus.
right.
Where the
So how
nail
do
plates
we?
get separated from the nail bed,
Right, right.
and
So
plus the
doctor,
nail
how do
turn.
they?
Hmm. Yeah,
Right.
tell me.
So how do they deal with it, doctor? It's a major issue, and definitely, I believe
Correct,
it becomes a little painful. So how to
correct,
deal with
correct.
it?
Yes. Mainly, you have to take oral tablets for that. Various tablets
Hmm.
are available for to treat the fungus of the nails. Plus, topical nail polish like things are available. Nail lockers we call, which has antifungal content. That has to be applied weekly once. Plus, oral medications for fingernails will give for 2 months. For toenails for 3 to 6 months we give.
Right, right. Doctor, you also mentioned initially that fungal infection can also appear in the scalp.
Mm. Yeah.
So
Yes.
can that lead to hair fall? Is it possible?
Yeah, yeah. We call tinea capitis, fungal
Hmm.
infection of the scalp. There'll be hair loss, patchy hair loss will be seen, and there'll be broken hair. Even the broken hair will
Right.
happen. Sometimes, in rare cases, even the swelling of the scalp will happens. We call
Right.
severe type of fungal infection like chirion is called. There'll be boggy swelling, pain, plus hair loss.
Right.
That is a
So,
severe type of uh,
right. So, does it majorly occurs because of the accommodation of the sweat in the scalp, or there can be any other reason behind it?
yeah, mainly because of sweating, even the more oil production. If the usually seen in the children, tinea capitis, all
Right.
these fungal infections, no, seen in children below 12 years, 14 years. If they don't
Right.
wash their scalp regularly,
Mm,
there'll be more sebum,
mm-hmm.
oil production, more sweat production. All this will induce the fungal protein. Children, especially in the children, it's seen.
Right. Doctor, another major question which I think everybody would want to know is fungal infection contagious?
Yeah, it's contagious. Yes, through skin contact, through clothes, it can spread to one person to another person.
So what are the major things which we need to keep in mind when somebody in our family is already suffering from fungal infection?
Better not to share the clothes, not to share the soaps and
Mm,
all, and skin contact to be avoided. Direct skin first, skin to skin contact to be avoided. These are the major things.
right.
Yeah.
Right. Another thing which we normally see in Indian household is we usually wash all the clothes together.
Mm.
We normally put it
Mm.
inside the washing machine, all the clothes
Correct.
together. So can
Yeah.
washing the clothes together also
Washing
somehow
together,
spread
not a
fungus?
problem. Not a problem.
Hmm.
It can be washed together because
Right.
detergents will be used. That will wash off all the fungal elements. Not a problem. But better not to share the clothes, like wiping the clothes or towels and all. Should not be shared.
Right. Doctor, initially we have spoken about the season which we are in right now. It is
Correct.
monsoon,
Correct.
and it is very hard to dry our clothes, especially sun drying the
Ah,
clothes is gets very tough. So,
correct. Correct. Yes.
does sun drying clothes also play a very important role in fungal
Yes. Yes.
infection? Can
Yeah.
damp clothes also, somehow trigger fungal infection?
Yes. Especially the sunrise are UV light, right? All these UV
Hmm.
rays will cause the damage to the fungus. Whatever the fungus is there on the clothes, like towels and inner clothes and all. When you sun dry, because of UV rays, all this fungus will die. Better to sun dry the clothes and wear after that instead of drying in the inside the closed rooms and all. Better to sun dry the clothes and after that we have to wear. That is always better.
Right. Right. Now let's talk about the treatments which are currently
Mhm.
available to treat fungal
Okay.
infections, doctor. What are the
Yeah.
current treatments which we normally
Mhm.
apply?
Usually we give oral tablets. Tablet treatment in the form of tablets we give. Lotions are also available. Even the creams are available.
Hmm,
Even the soaps are also available. Some body wash is also available. The main mode of
hmm,
treatment is tablets. Nowadays, fungus has become very resistant to the conventional treatments. That's why
hmm,
very lengthy treatment is required. And
right,
I advise the patients and all not to use whatever the creams available. Going to a medical shop, buying a cream, applying those creams will cause more problem. It will aggravate the fungal infection because majority creams, whatever is available, no, it has steroids. All this will steroid containing creams, no, it will aggravate the fungal infection. Better to avoid whatever over the counter creams and all. They have to go to a proper dermatologist, qualified dermatologist, and take a proper advice. Then only they have to apply all the creams.
right.
That's a major issue we have seen.
Doctor, right, right. We were about to talk about this major issue, which
Yeah.
definitely you have already mentioned. People,
Mm.
we normally see them nowadays. Self-medication has become very common, or they
Correct,
will
correct.
visit the
Yes.
chemist, or the chemist will suggest them
Yeah.
any sort of
Correct,
steroids, as
correct.
you mentioned.
Yes, yeah.
And then after the regular reapplication, when they finally see that it has gone out of hand, that is the moment
Mm.
when we visit the
Correct,
doctor.
correct. Yes.
So, are we also saying that in case of fungal infection, also it can be very harmful?
Yeah, it would be very harmful. Nowadays, it has become very difficult to treat. It is taking three
Hmm,
months, 6 months to get cure of fungal infections. It's mainly because of the resistance, the fungal resistance.
right,
Fungus has become very strong. Regular ointments, tablets are not working. Why is happening? It's because of steroid trees. Steroids will make
right,
the fungi very strong and very resistant to the conventional mode of treatment. and it's happening
Right.
throughout the world. So it's like a global issue now, the fungal resistance thing.
Right, right. Doctor, initially you also mentioned about vaginal fungal infection,
Yes,
which
yes.
women they are
Mm.
suffering on a daily basis,
Correct.
no matter
Yes,
whichever season it is.
correct.
Using public toilets, we will definitely
Mm.
talk about it. That
Correct,
can
correct.
be using public toilets or
Yeah,
the toilets while they're traveling in the
mm.
trains. Can those
Correct, correct.
also somehow
Yeah,
trigger fungal infection? And
correct, correct.
the first question which I wanted to ask you
Mm.
is when they
Mm.
see such sort of infection occurring
Mm.
in the genital area, whom
Mm.
should they initially visit? A dermatologist or a gynecologist?
Better to visit a dermatologist because all these
Right.
fungal infections, will be gynecologists. If you visit, they will give combination of treatment. Kit containing antifungal, antibacterial, antiviral. Those kits I usually come across. Whatever the
Hmm.
patients come to me, they have been advised this kit by the gynecologist in majority of cases because antibacterial and antiviral tablets are not required in case of fungal infection. If they come to a
Right.
dermatologist, will make a proper diagnosis. Then exclusively we can treat a fungus instead of treating extra for virus and bacteria and all. Better to consult a dermatologist first, I feel.
Right. Right. So, doctor, again
Hmm.
coming back to the same point, can public toilets
Ah,
be a reason for the occurrence of fungal infection in the genital area?
yeah, that could be the one of the reasons. Yes, public toilets usually be unhygienic, and anyway, skin contact will happen. Through the skin contact, easily the fungus will spread from one person to the other. That is better to avoid
Right.
as much as possible to use public toilets.
But what if they are working in a public area
Hmm.
or an office area where there
Hmm.
are there are people
Maybe they can,
of 100 to 100?
yeah, they can spray some sanitizer on the toilet seat before using it.
Right, right. Doctor,
Better to use that.
another question, because
Hmm.
we are talking about particularly vaginal fungal infection. We see a lot
Okay.
of products nowadays which are available in the market, all those V
Ah.
wash
Ah.
and the genital wash which are available.
Correct. Hmm.
Can those be safe to apply, or should we normally avoid it?
All these products won't help in preventing fungal infection.
Hmm.
All this we wash and all mainly targeted on the bacteria. Fungi and all
Right,
it won't target. So this all these products may not help in preventing the fungal infection.
right. Right. Doctor, again, coming back to the overall
Hmm.
health,
Hmm.
can having a poor immunity somehow
Hmm.
trigger fungal infection? Is it possible? Are they interlinked?
Hmm. Sorry, are we?
Right. What I was asking is a
Hmm.
poor immunity
Hmm.
and fungal
Yeah.
infection, can they be interlinked? Having a poor immunity, can it trigger
Hmm.
fungal infection?
Yeah, pure immunity definitely will trigger fungal infection, but it will be a different kind of fungal infection, especially fungal infection of the mouth, esophagus, and there's one fungal infection called cryptococcosis. All these
Hmm.
fungal infections are seen in immunocompromised people, HIV, HIV, like especially HIV patients, AIDS patients we see. But regular fungal infection can happen even in the normal immunity people, like tinea, that round ringworm infections and all. Now it can happen in normal immunity people also.
Right.
Immunocompromised people will have a different kind of fungal infections, like esophageal candidiasis, cryptococcosis,
Hmm.
those kind of fungal infections.
Right. Doctor, because you are mentioning the kind of fungal infections, what can be the most troublesome or dangerous kind of fungal infection available?
More troublesome is the steroid modified fungal infections, especially when the fungal infection is there, they go to the chemist, they'll put some steroid creams or they may take some oral steroids also. That will modify the fungal infection, and the fungus becomes very strong, very resistant, and it become widespread throughout the body. It would have spread all over the skin, all
Hmm.
over the body. Those cases are really, very difficult to treat. You have to use combination of antifungal tablets. 2, 3 antifungal tablets you have to combine and give, and it will run for 6 months. 1 year treatment has to be given. It's quite difficult to treat those cases.
Right, right. So basically, we are saying that those cases are can only be caused by us. We are the one who are
Yes, yes,
responsible behind those
correct,
cases.
correct,
Right.
exactly.
So, yes, what we always suggest our patients, our viewers is not to self-medicate. This is the worst thing you are
Correct.
doing to yourself. You are troubling yourself. You're putting your health at risk. You're also troubling the doctor, which whom you are going to visit today or tomorrow.
Correct.
We might think that we do not need to visit the doctor just because we have the medicine in our hand. Don't think so. Everybody has a different body. Everybody needs a different sort of medication, so make sure
Correct.
you are visiting your expert whenever you see a different change in your body. Speaking about antifungals, doctor,
Hmm.
people normally they have a kind of myth in their mind that they can
Hmm.
stop taking antifungals once they
Hmm.
see their
Correct.
affected area healing.
Yes.
So,
Yes.
can stopping antifungals be safe?
They should not supposed to stop on their own because they won't be won't be able to assess the whether the fungus has healed fully or not. Because they may say the fungus has gone and they will stop, but even the 1% if it remains, no, it comes back. That's the main issue. They should not stop the medications on their own. They have to consult a dermatologist. Dermatologist will examine properly. If he finds it has gone 100%, then only it has to be stopped. Even 1% if it
Right,
remains, it will come back. Recurrence is very, very common in fungal infections.
right. So, what are the normal antifungals which we normally use to treat fungal infection?
Usually we use itraconazole is the drug of choice as of now. Before we used to use terbinafine, fluconazole, griseofulvin. All these products are used, but mainly itraconazole is the drug of choice as of now.
Right. So,
Or,
why the change? Why the change in the drug? Last time also, I was attending
mm,
a seminar where the
okay.
doctors were mentioning that they are changing the kind of
Yes,
drugs which they use to treat fungal
it's
infection.
mainly
So,
because
why this drastic change?
of resistance. Before
Right.
fungus used to get treated in 1 week. If you treat for 1 week, it will go. Now it has become months, 3 months, 6 months we have to treat. Before it used to be very sensitive to the fluconazole. Even a simple drug like
Mm,
terbinafine it used to be get cured. But now these medications have become very resistant. All these medications are not working. That's why you're using a newer molecules like itoconazole, voriconazole, and all we're using mainly because of resistance.
right. Doctor, another troublesome aspect of
Hmm.
fungal infection is the reoccurrence of it. So, people
Yes.
are very much bothered, tired, because of course it's a painful thing, also somehow bothersome for the people
Hmm.
they are staying with, the surrounding they are going and mingling into. So,
Hmm.
why does this reoccurrence happen again and again?
Because not sticking to the treatment. Usually they take it for 2 weeks, 3 weeks. After that, they will stop it off.
Hmm.
That is the main cause of recurrence. They
Right.
have to stop only it is gone 100%. If they stop in between, it comes back. 2 minutes.
Right. Doctor, another
Hmm.
thing which, because we are talking about the overall health, diet
Okay.
somehow plays a very important role if we are talking about a wholesome health, or a wholesome body.
Correct. Correct. Yeah.
Does diet has any relation with fungal infection? Any sort of diet which one should have normally to stay away from it?
Especially the candidiasis, the yeast infection and all, mainly happens in diabetic people. If they have uncontrolled diabetes, no, they tend to get this yeast infection like oral candidiasis or genital candidiasis, even the scalp, seborrheic cavities and all, is usually related to high sugar intake. Better to avoid sugars in all these cases. People
Right.
tend to have fungal infections. No, they should avoid sugar intake. Fungus tends to grow on sugar.
Right. Doctor, also tell us
Mhm.
what is the role of hygiene in fungal infection?
Yeah, best hygiene is to wash regularly, keep the area dry, and yeah, they have to wipe regularly, especially intergenous area, the rubbing areas. No, maybe with the dry cotton or dry tissue papers, they have to wipe regularly so that there'll be less moist content in that area, and they have to wash
Right.
regularly.
Right.
More sweat,
Doctor,
more oil production.
Right. Doctor, can those antifungal powders,
Uh,
which are available in the market, can those be used uh, for,
yeah, those can be
prevent
used.
as a prevention?
Yeah, to some extent it will help, especially the inner thigh areas and all. They can spray regularly, but the main mode of treatment is oral medications, tablets. These are all only supportive treatments, we can say. The powders, the soaps, and all.
Right, right. With that, doctor, I can see a few questions coming up from the viewers.
Okay.
The first question comes from uh, Pooja Sharma, who asks, "How long does it take to recover from a fungal infection?"
It depends upon the size of the fungus. If they have one or two patches with less size, it may get recovered in 10 to 15 days. If they have more patches, it will take more longer time. Usually, treatment goes for 2 to 3 months. Regularly, usually the whatever we do, no, it continues for 2 to 3 months.
Right. Next question, doctor, comes from a viewer
Uh,
who asks, "Can
uh,
fungal infections be prevented?"
yeah, by maintaining proper hygiene, using washes regularly, making the skin dry, it can be prevented.
Right. Doctor, also tell us, how can one prevent from getting ringworm on the feet frequently if somebody is having it?
Yeah, they have to make the area dry and regular wear of shoes and all, continuous wear of shoes and all to be avoided. And whenever it gets wet, especially wet spaces and all, finger toe spaces and all, has to be wiped regularly. When there is more wet in between the toes, they tend to grow the yeast like candidiasis is very common between the toe fingers. That's why they have to keep the area dry and the continuous wear of shoes to be avoided.
Right. Because we were talking about antifungals a while
Uh,
ago. Doctor,
uh,
can these oral antifungals be
uh.
taken during pregnancy?
Certain oral antifungals can be taken, depends upon which fungal infection the person has. Especially fluconazole is one drug called fluconazole that can be given safely during pregnancy in the lactation at all.
Right. The next question, doctor, comes from Pooja Sharma.
Mm. Okay.
Sorry. The next question comes from Kelan Singh, who asks, over-the-counter treatments for fungal infection.
Uh,
What are the over-the-counter treatments for fungal infections?
Over the counter treatments, I never recommend because all this chemists and all will be having no idea about fungals. Usually, they give creams having steroid combination creams. They usually give better to avoid OTC medications.
Right. Right. Uh, right. Doctor, are these antifungals safe to be taken in a long term?
Yeah, it's very safe. Up to 6 months, 1 year, we have given, nothing happens. Usually, people with normal immunity, without any concomitant any diseases, usually give for 6 months to 1 year, nothing happens. Only if they have some liver issues or if they have some kidney issues, then only have to be a little careful while giving the antifungals.
Right.
Otherwise, no
Uh,
issue.
right. The next question, doctor, comes from Firoz
Hmm.
Khan, who asks,
Ah,
"My nails are discolored and thick.
okay.
Is this a kind of fungal infection?"
It could be a fungal infection. Even other causes of nail discoloration has to be ruled out. Maybe it could be a fungal infection only. Usually in fungal infection, nail will turn little dark and there'll be scaling. Chapping of nails happens. Scaling happens. It becomes very dry, rough and all. And it happens at the distal end of the nail.
Right, right. Uh, right. Uh, it was a very interesting and informative session, doctor, from your side today. Before we take a leave today, any take-home message for our viewers who has watched us so far?
Mainly advised not to go for OTC medication for fungal infections. And I want to tell them to complete the full course of the treatment and not to stop in between. And main important thing is they have to avoid steroid in the antifungal medication. Steroid is never a part of antifungal medication.
Right. Well, that was the expert advice for today, and that was Dr. Sunil Kumar for us. Thank you so much, Doctor, for your valuable time. We could clearly see you were busy, but then you have taken out your valuable time for us. Thank you so much for that. It has been a very informative session for our viewers today, and we look forward to many more such session in coming time. Also, thank you,
Sure.
viewers, for your excellent participation. For more information and updates, stay connected on our Skin Health and Care page, which is the FB page of All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.
Thank you. Thank you so much.